When I first took office, exactly 9 years ago this week, actually, Lyme and Tick-Borne Disease Awareness Month was in May, and Lyme disease was widely considered to be a problem largely limited to the Hudson Valley, Lyme, Connecticut, and very few other places. Today, Lyme disease has been reported in every state in the United States. There are more than a dozen tick-borne illnesses in the United States, in addition to Lyme disease, and one tick may carry more than one disease, resulting in people receiving a co-infection from a single tick bite. Climate change, which we are talking about today on Earth Day, is causing New York to experience longer and more severe tick seasons, with the majority of tick-to-human bites occurring in the warmer months when ticks are most active and when more people are enjoying the outdoors. So we are recognizing April as Lyme and Tick-Borne Disease Awareness Month, though it's important to understand that ticks can be active any time of the year when the temperature is above freezing. Lyme disease, its co-infections, and other tick-borne diseases are generally hard to diagnose because their symptoms often mimic those of dozens of other common illnesses, and they can present symptoms that are sometimes misdiagnosed as everything from mental illness, depression, nutritional deficiencies, or Alzheimer's disease. There have been several articles recently, in fact, documenting the similarities between the symptoms of Lyme disease as well as the long-term impacts between COVID and Lyme disease. And there are an alarming number of similarities. Within New York State, we now have two cutting-edge centers that are working on Lyme and tick-borne disease research, diagnosis, education, and treatment. One is at Upstate Medical in Syracuse, and the other is at Columbia University in New York City. While these are both great additions to the grassroots work being done across the state, if you take a look at the budget we just passed and look for Lyme or tick-borne disease, there is barely a mention. It is not a priority of our Department of Health or our leadership, and it really needs to be. Let me leave you with some facts here. Lyme disease is on every continent, including Antarctica. 40% of Lyme patients have long-term health problems with symptoms. Fewer than 50% of patients with Lyme disease recall a tick bite. Fewer than 50% of patients with Lyme disease get a bullseye rash. Chronic Lyme is still not fully recognized by many infectious disease doctors. And here is a visual image for you. 200 children get Lyme disease every single day. That's 4 school buses of children in a single day. It's time for all of us to hashtag get ticked off. Thank you very much, Mr. Speaker.